Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospital, Chennai. In this video, I will talk to you about both knee replacements in a single stage. Knee replacement is a fairly common procedure nowadays. A lot of you would have heard about knee replacements. There has been a lot of confusion amongst patients whether to go for a replacement of both knees or only one knee at a time. So there was a period when this was not undertaken very frequently, but today a lot of surgeons, hospitals across the world do both knee replacements in a single stage, and this is definitely possible in today's world. So the thing before going to whether it can be done is whether it needs to be done. So it depends on the condition of the knees. If only one knee is damaged and one knee is causing pain, then we generally do only that knee which is painful. The other knee is not much damaged, it's not hindering with the ability of the patient to walk well, not giving much pain, then it can wait. So if both knees require knee replacement, then definitely it is possible to do it, but it is not for everyone. So what are the factors that decide whether we do replacement of both knees when it is decided versus one knee now and the other a few months later? So most important is the age of the patient. So single knee replacement generally takes about 1 hour 15 minutes. So when we do both knees, it is generally twice the time, about 2.5 hours it will take. So it takes from the surgery duration is doubled. So we have to look at the age, general condition and the hemoglobin level of the patient. So talking about age, ideal age for a knee replacement generally falls somewhere between 55 to 80 years of age. Less than 55, they are fairly young, so they are very likely to require revisions in the future. So we generally try to fix it as somewhere around 55, but it is not a hard number. Again, above 80 years of age, the general risks are slightly higher. So if you look at an ideal age for knee replacement, it is 55 to 80 years. Within this age group, people less than 65, 70 years of age are generally more healthier and have a better functioning than patients who are 70 plus. So when we want to do both knees, the first thing that comes to the decision making is the age. People less than 65, 70 years of age are better for candidates for a both knee replacement in a single stage because their functional capacity is better. Over 70, we generally tend to reserve it for extremely healthy people who are having heart and lungs in excellent condition. So in general, less than 70 would be my criteria for doing both knees in one stage. Again, not only age, the general condition also matters quite a lot. If the heart, lungs, kidney, liver, all these are in good shape, then again, these are better candidates for having both knees replaced in one sitting. If there are heart or lung issues, then generally we do one knee at a time. The third thing that comes to the decision making is the hemoglobin level. Generally, it drops by about 1 to 2 grams with each knee replacement. If you do both knees, then it will gently drop by about 2 to 3 grams. So again, what is the starting level of hemoglobin makes the decision for us sometimes. So if the starting hemoglobin is 10 or less, then with both knees being replaced, they are likely to require blood transfusions with the both knee replacement. So generally, if the hemoglobin is 11 or above, then it is most conducive for a both knee replacement in a single stage. If it is less than that, then do one knee now and the other knee once the patient recovers, which means we have to give him several weeks. So these are the three things that mainly make the decision. Just to give you an example, this was a patient who was around 65 years of age. You can see that he has severe problem in both knees. Both knees are bent. We call it as knock knees. He is having severe knock knees and having severe problem with walking. So he definitely requires replacement of both knees. But given that his age is less than 70, his hemoglobin was fine. He did not have any major systemic illnesses. So we decided to replace both knee in a single stage. This is him a few days after the surgery on the photo. The video is taken about 6 weeks after his surgery. You can see that both knees have been replaced in a single stage, and he is walking fairly well compared to his pre-surgical status. And it is now a few years since his surgery, and he continues to do well. On the other hand, if you look at this gentleman, he again has problem with both knees. Both knees are bent but in different directions. So because the knees are bent in different directions, he also has a lot of problem with this balance. So we call this as a windswept deformity, where the knees are bent in different directions. So both knees are required, but whether we can do both knees in one stage is again a question. He was 73 years old at the time of his surgery. He also had reduced lung capacity from a previous COVID infection. Therefore, we decided to stage the knee replacement, meaning first we did the right knee, and then several weeks later we did the right knee. And this was him about a month after his both knee replacement surgery, and he is doing well. Both knee replacement meaning staged both knee. After first knee, the second knee was done after a few weeks, and this is how his recovery was. So to put it in a nutshell, definitely doing both knee replacements in a single stage is possible, but there are certain criteria. If both knees require replacement, they can be done providing the age is on the slightly younger side, meaning preferably less than 65-70 years of age, not have any major systemic illnesses. General condition has to be good, heart, lung, kidney, liver, these have to be good, and the hemoglobin again has to be good. So when these are good, we can definitely do both knee replacements in a single stage. Thank you.